if we suspect H. pylori.
Like what?
The urea breath test is very good, often considered the gold standard for detecting an active infection.
How does that work?
You drink a liquid containing urea with a special carbon isotope. If H. pylori is there, its urease enzyme breaks down the urea, releasing labeled carbon dioxide, which you breathe out, and we measure it.
Clever.
Yeah. There's also a stool antigen test. Looks for H. pylori proteins in a stool sample. Also very good for active infection.
Okay. What about blood tests for H. pylori?
This is a really important point. The antibody blood test, serology. It can only tell you if you've been exposed to H. pylori in the past.
Not if you have it now.
Exactly. The antibodies can stick around for years even after the infection is gone. So it's not useful for diagnosing a current infection or seeing if treatment worked. Big limitation.
That's a crucial distinction. Good to know. Other non-invasive tests.
We might do a CBC, a complete blood count, to check for anemia if we suspect bleeding. And if Zollinger-Ellison syndrome is on the radar, we'd check serum gastrin levels.
Right. But to actually see the ulcer, you need something more direct.
Yes. For a definitive look, the main test is an EGD, esophagogastroduodenoscopy.
It's a poke test.
The scope test, exactly. A thin, flexible tube with a camera goes down the throat. Allows the doctor to directly visualize the lining of the esophagus, stomach, and duodenum.
So they can see the ulcer.
See it, assess its size, location, and crucially, take biopsies, little tissue samples.
Why are biopsies so important?
Especially for gastric ulcers, it's vital to rule out cancer. Some stomach ulcers can actually be malignant. Biopsy is the only way to know for sure.
Okay. Very important.
Plus, during the ETD, they can do a quick test on a biopsy sample for H. pylori right then and there. It's called a rapid urease test or CLO test.
Gotcha. Any role for imaging like X-rays or CT scans?
Usually only if we suspect complications. An upright chest X-ray can show free air under the diaphragm if there's a perforation, this air leaking out.
Okay.
And a CT scan of the abdomen might be used for a better look at complications like perforation or maybe an abscess.
Right.